Nanobots, tiny doctors revolutionizing medicine. Nanotechnology, the science of manipulating matter on an atomic and molecular scale, has paved the way for numerous advancements across various fields. One of the most promising and revolutionary applications of nanotechnology is in the field of medicine, particularly through the development of nanobots. These tiny robots, often measured in nanometers, 1/1,000,000th of a meter, have the potential to act as tiny doctors, performing tasks that can diagnose, treat, and prevent diseases at a cellular level. This video drills into the concept of nanobots, their potential applications in medicine, the benefits they offer, and the challenges that lie ahead. What are nanobots? Nanobots, also known as nanorobots or nanomachines, are microscopic robots designed to perform specific tasks at the nanoscale. These tiny devices can be engineered to interact with biological systems, manipulate molecules, and perform complex functions that are currently beyond the capabilities of traditional medical treatments. Nanobots can be made from a variety of materials, including metals, polymers, and biological molecules. They are often equipped with sensors, actuators, and other components that enable them to detect and respond to their environment. In the context of medicine, nanobots can be programmed to deliver drugs, repair tissues, detect pathogens, and even destroy cancer cells. Potential applications of nanobots in medicine. Targeted drug delivery. One of the most promising applications of nanobots is in targeted drug delivery. Traditional drug delivery methods often involve systemic administration, where drugs are distributed throughout the body, affecting both healthy and diseased tissues. This can lead to side effects and reduced efficacy. How nanobots can help. Precision targeting. Nanobots can be programmed to deliver drugs directly to specific cells or tissues, minimizing side effects and maximizing therapeutic effectiveness. Controlled release. Nanobots can release drugs in a controlled manner, ensuring a consistent and optimal dosage over time. Cancer treatment. Nanobots can be designed to identify and target cancer cells specifically, delivering chemotherapy drugs directly to the tumor site while sparing healthy tissues. This can reduce the toxic side effects associated with traditional chemotherapy. Disease detection and diagnosis. Early detection and accurate diagnosis are crucial for effective treatment of many diseases. Nanobots can be used to detect diseases at their earliest stages by identifying molecular markers and other indicators of disease. How nanobots can help. Biomarker detection. Nanobots can be equipped with sensors that detect specific biomarkers associated with diseases, such as proteins, nucleic acids, or other molecules. Imaging enhancement. Nanobots can enhance medical imaging techniques by providing high-resolution images of tissues and organs at the cellular level. Early cancer detection. Nanobots can detect the presence of cancer biomarkers in the bloodstream, allowing for early diagnosis and timely intervention. Tissue repair and regeneration. Nanobots have the potential to revolutionize tissue repair and regeneration by facilitating the healing process at the cellular level. How nanobots can help. Cell repair. Nanobots can repair damaged cells by delivering essential nutrients, removing cellular waste, and promoting cellular function. Tissue engineering. Nanobots can assist in the regeneration of damaged tissues by providing structural support and guiding the growth of new cells. Wound healing. Nanobots can accelerate the healing of wounds by promoting the growth of new blood vessels and tissues, reducing the risk of infection and scarring. Fighting infections. Nanobots can be designed to combat infections by identifying and destroying pathogens, such as bacteria and viruses. Antimicrobial action. Nanobots can release antimicrobial agents that kill or neutralize pathogens without harming healthy cells. Immune system support. Nanobots can enhance the body's natural immune response by targeting and eliminating pathogens more effectively. Antibiotic-resistant infections. Nanobots can be used to treat infections caused by antibiotic-resistant bacteria, offering a new approach to combating these difficult-to-treat pathogens. Neurological disorders. Nanobots have the potential to transform the treatment of neurological disorders by delivering therapies directly to the brain and nervous system. How nanobots can help. Blood-brain barrier penetration. Nanobots can cross the blood-brain barrier, a protective barrier that prevents many drugs from reaching the brain, allowing for targeted delivery of therapeutic agents. Neuroprotection. Nanobots can protect neurons from damage and promote the repair of neural tissues. Parkinson's disease. Nanobots can deliver neuroprotective agents to the brain, slowing the progression of Parkinson's disease and improving patients' quality of life. Benefits of nanobots in medicine. Precision and accuracy. Nanobots can perform tasks with remarkable precision and accuracy, targeting specific cells and tissues without affecting surrounding healthy tissues. This level of precision can lead to more effective treatments with fewer side effects. Minimally invasive procedures. Nanobots can be introduced into the body through minimally invasive procedures such as injections or ingestion. This reduces the need for surgical interventions and associated risks. Enhanced drug efficacy. By delivering drugs directly to the site of disease, nanobots can enhance the efficacy of treatments. This targeted approach ensures that therapeutic agents are concentrated where they are needed most, improving outcomes. Real-time monitoring. Nanobots can provide real-time monitoring of physiological parameters, allowing for continuous assessment of a patient's condition. This enables timely adjustments to treatment plans and improved patient management. Personalized medicine. Nanobots can be tailored to individual patients, allowing for personalized treatment plans based on a patient's unique genetic and physiological characteristics. This personalized approach can lead to more effective and efficient healthcare. Challenges and ethical considerations. While the potential benefits of nanobots in medicine are immense, there are several challenges and ethical considerations that must be addressed. Safety and biocompatibility. Ensuring the safety and biocompatibility of nanobots is crucial. Researchers must carefully evaluate the potential toxic effects of nanobots on the body and ensure that they do not cause unintended harm. Nanobots must undergo rigorous testing and regulatory approval before they can be used in clinical settings. This process can be time-consuming and requires thorough evaluation of their safety and efficacy. Ethical concerns. The use of nanobots in medicine raises ethical concerns, such as patient consent, privacy, and the potential for misuse. It is essential to establish ethical guidelines and regulations to address these concerns. Developing nanobots that can navigate the complex and dynamic environment of the human body poses significant technical challenges. Researchers must overcome obstacles related to power supply, control mechanisms, and communication. Cost and accessibility. The development and deployment of nanobots may be costly, potentially limiting their accessibility to patients. Efforts must be made to ensure that these advanced technologies are affordable and available to all who need them. Future prospects of nanobots in medicine. The future of nanobots in medicine is promising, with ongoing research and technological advancements paving the way for new applications and improved outcomes. Here are some potential future developments. Smart drug delivery systems. Future nanobots could be equipped with advanced sensors and control mechanisms, enabling them to deliver drugs in response to specific physiological signals. This smart delivery system could optimize drug efficacy and minimize side effects. Regenerative medicine. Nanobots could play a crucial role in regenerative medicine by facilitating the repair and regeneration of damaged tissues and organs. This could lead to breakthroughs in the treatment of conditions such as spinal cord injuries, heart disease, and degenerative disorders. Cancer treatment. Nanobots have the potential to revolutionize cancer treatment by providing highly targeted and personalized therapies. Researchers are exploring the use of nanobots to deliver gene therapies, immunotherapies, and other advanced treatments directly to cancer cells. Advanced diagnostics. Nanobots could be used to develop advanced diagnostic tools that provide real-time monitoring of disease markers and physiological parameters. This could enable early detection and intervention, improving patient outcomes. Integration with wearable technology. The integration of nanobots with wearable technology could provide continuous health monitoring and personalized healthcare. Wearable devices could communicate with nanobots, allowing for real-time adjustments to treatment plans and enhanced patient management. Nanobots represent a groundbreaking advancement in the field of medicine, offering the potential to revolutionize the diagnosis, treatment, and prevention of diseases. By performing tasks with precision and accuracy at the cellular level, these tiny doctors can enhance drug delivery, detect diseases early, repair tissues, and combat infections. Continued research and technological advancements will pave the way for new applications and improved patient outcomes, ultimately transforming healthcare and improving the quality of life for millions of people worldwide. As we move forward, the integration of nanobots into medical practice holds the potential to redefine the future of medicine, bringing us closer to a world where diseases can be treated with unprecedented precision and efficacy. If you received value from this video, please like and subscribe to the channel.